This presentation will address the issue of compassion fatigue. By the end of this presentation, the learner will be able to list at least 3 symptoms of compassion fatigue, as well as be able to describe the impacts of compassion fatigue in healthcare and summarize the impacts of compassion fatigue in society. Compassion fatigue can be described as the physical, emotional, and spiritual result of chronic self-sacrifice and/or prolonged exposure to difficult situations that renders a person unable to love, nurture, care for, or empathize with another's suffering. Compassion fatigue involves triggering events based on nurses taking care of patients who are experiencing serious, life-threatening situations and cases involving fetal or palliative care, such as those seen in intensive care units or emergency departments. It's a combination of physical, emotional, and spiritual depletion associated with caring for patients in significant emotional pain and physical distress. Compassion fatigue is a unique form of burnout that affects individuals in caregiving roles. Take a minute to pause the video and read through the signs and symptoms of compassion fatigue. As you can see, there are a wide variety of physical and emotional symptoms that affect the caregiver's work. As opposed to the progressive onset and indifference of burnout, compassion fatigue can have a more acute onset and precipitate over-involvement in patient care. Nurses experiencing compassion fatigue can experience a decline in personal health, leading to inadequate nursing performance, such as medical errors related to poor judgment and decreased discernment. Inadequate nursing performance can also be reflected as a decreased quality of patient care and patient dissatisfaction. Moral distress and avoidance behavior experienced with compassion fatigue can increase emotional distress and may even result in long-term absenteeism or threaten brain and skill drain if the professionals leave their jobs prematurely to preserve their own health. Compassion fatigue is identified as one of the reasons valuable healthcare providers disengage from their work and have noticeable changes in their clinical practice. One of the more prominent consequences of compassion fatigue is inadequate performance. Patient satisfaction is at the forefront of hospital reimbursement. With decreased patient satisfaction due to healthcare providers experiencing compassion fatigue, healthcare facilities lose out on their reimbursements. Nurses leave the profession as they experience career dissatisfaction, poor job satisfaction, and feelings of spiritual emptiness. Continuing to lose valuable healthcare providers to preventable causes has detrimental effects on a healthcare system with growing demands. With growing nursing shortages, leaving the profession could be devastating for the provision of excellent nursing care. In addition, the cost of replacing a healthcare provider is substantial. The average cost of turnover for a single RN is up to $57,000, which is a yearly estimated cost of $729 million in the United States. The compassion and empathy shown by healthcare, emergency, and community service professionals can prove physically, mentally, and economically costly. Exposure to patients or clients experiencing trauma or distress can negatively impact professionals' mental and physical health, safety, and well-being, as well as that of their families, the people they care for, and their employing organizations. Families, friends, and entire communities seek nurses for support, healing, and encouragement during times of physical, emotional, and spiritual anguish. Nurses have the innate capacity to nurture and embrace others' sufferings as if it was his or her own. With compassion fatigue, nurses may no longer be able to feel compassion for or empathize with their loved ones. Economic burdens also result from professionals leaving their jobs prematurely. Compassion fatigue in healthcare professionals can be chronic and economically costly mental disorders. Society and the economy is burdened with the retention of healthy, productive workers who service those in need of healthcare and social assistance. As mentioned earlier, the cost of nursing turnover can cost over $700 million in the U.S., which creates a huge economic and societal burden, not only to pay for the cost of replacement, but also to find new quality healthcare providers despite a national nursing shortage. In conclusion, compassion fatigue is a combination of physical, emotional, and spiritual depletion associated with caring for patients in significant emotional pain and physical distress. Physical symptoms can include headaches, sleep disturbances, or fatigue, while emotional symptoms can be mood swings, irritability, or excessive substance use, and work-related symptoms include avoidance or dread of working. Compassion fatigue influences nursing practice by decreasing the quality of patient care through poor judgment and decreased discernment. In healthcare, compassion fatigue can be very costly to facilities as healthcare providers leave their profession and patient satisfaction decreases. Compassion fatigue can cause an economic impact through nursing shortages as, again, healthcare providers leave their profession. Remember, if your compassion does not include yourself, it is incomplete. Thank you for your time, and I hope you enjoyed this presentation.